How long does the flu last? Most people recover from the flu in about 1 week. But it may take several more days for you to feel back to your usual self. It's not uncommon to feel tired for several days after your flu symptoms have subsided. It's important to stay home from school or work until you've been free of fever for at least 24 hours, and that's without taking fever-reducing medications. If you have the flu, you're contagious a day before your symptoms appear and up to 5 to 7 days afterward. Side effects of the flu shot. Many people report avoiding the flu vaccine each year for fear that it will make them sick. It's important to understand that the flu vaccine can't cause you to develop the flu. You aren't going to become sick because you received the vaccine. Flu vaccines contain the dead flu virus. These strains aren't strong enough to cause an illness. However, you may experience some side effects from the flu shot. These side effects are often mild and only last a short period of time. The side effects of a shot outweigh the possible symptoms of a flu infection later. The most common side effects of the flu shot include soreness around the flu shot injection site, low-grade fever in the days immediately following the injection, mild aches and stiffness. Any side effects that do occur often last only a day or two. Many people won't experience any side effects. On rare occasions, some people may have a serious allergic reaction to the vaccination. If you've had an allergic reaction to any vaccine or medication before, talk with your doctor. Learn more about the possible side effects of the flu shot. Treatment options for the flu. Most cases of the flu are mild enough that you can treat yourself at home without prescription medications. It's important you stay home and avoid contact with other people when you first notice flu symptoms. You should also drink plenty of fluids. This includes water, soup, and low-sugar flavored drinks. Treat symptoms such as headache and fever with OTC medications. Wash your hands to prevent spreading the virus to other surfaces or to other people in your house. Cover your coughs and sneezes with tissues. Immediately dispose of those issues. If symptoms become worse, call your doctor. They may prescribe an antiviral medication. The sooner you take this medicine, the more effective it is. You should start treatment within 48 hours from when your symptoms start. Contact your doctor as soon as symptoms appear if you're at high risk for flu-related complications. These high-risk groups include people with weakened immune systems, women who are pregnant or up to 2 weeks postpartum, people who are at least 65 years old, children under 5 years old, in particular, those under 2 years old, people who live in chronic care facilities or nursing homes, people who have chronic conditions, such as heart or lung disease, people who are of Native American, American Indian or Alaska Native descent. Your doctor may test for the flu virus right away. They may also prescribe an antiviral medication to prevent complications. When is the flu season? In the United States, the main flu season stretches from late October to March. Cases of the flu peak during February, according to the Centers for Disease Control and Prevention (CDC) trusted source. But you can get the flu at any time of the year. Remedies for flu symptoms. Being ill from the flu is no fun. But remedies for flu symptoms are available, and many of them provide great relief. Keep these treatments in mind if you have the flu. Pain relievers. Analgesics like acetaminophen and ibuprofen are often recommended to help ease symptoms. These include muscle aches and pains, headache, and fever. Warning: children and teens should never take aspirin for an illness. This is because of the risk of a rare, but fatal, a condition called Reye's syndrome. Decongestants. This type of medication can help relieve nasal congestion and pressure in your sinuses and ears. Each type of decongestant can cause some side effects, so be sure to read labels to find the one that's best for you. Expectorants. This type of medication helps loosen thick sinus secretions that make your head feel clogged and cause coughing. Cough suppressants. Coughing is a common flu symptom, and some medications can help relieve it. If you don't want to take medication, some cough drops use honey and lemon to ease a sore throat and cough. Be careful not to mix medications. Using unnecessary medication could cause unwanted side effects. It's best to take medicines that apply to your predominant symptoms. In the meantime, get plenty of rest. Your body is fighting hard against the influenza virus, so you need to give it plenty of downtimes. Call in sick, stay at home, and get better. Don't go to work or school with a fever. You should also drink plenty of fluids. Water, juice, sports drinks, and soup can help you stay hydrated. Warm liquids like soup and tea have the added benefit of helping ease pain from a sore throat. If you think you have the stomach flu, check out these remedies. Flu symptoms in adults. Flu-related fever appears in adults and can be severe. For many adults, a sudden high fever is the earliest symptom of a flu infection. Adults rarely spike a fever unless they have a serious infection. The flu virus causes an abrupt high temperature that's greater than 100 degrees Fahrenheit, 37.8 degrees Celsius. Other viral infections, like a cold, may cause low-grade fevers. Beyond this, children and adults share many of the same symptoms. Some people may experience one or several symptoms more than another person. Each person's influenza infection will be different. What's the incubation period for the flu? The typical incubation period for the flu is 1 to 4 days. Incubation refers to the period during which the virus is in your body and developing. During this time, you may not show any symptoms of the virus. That doesn't mean that you aren't contagious. Many people are capable of spreading the virus to others a day before symptoms appear. The millions of tiny droplets, which are produced when we sneeze, cough, or talk, spread the flu virus. These droplets enter your body through your nose, mouth, or eyes. You can also pick up the flu by touching a surface that has the virus on it and then touching your nose, mouth, or eyes. Is there such a thing as the 24-hour flu? The 24-hour flu is a common infection that has nothing to do with influenza, despite sharing a name. The 24-hour flu is caused by a genus of viruses called norovirus. The symptoms of a norovirus infection include diarrhea, nausea, vomiting, stomach cramping. These symptoms occur in the gastrointestinal system. That's why the 24-hour flu is sometimes called stomach flu. Although it's called the 24-hour flu, you may be ill for up to 3 days. The symptoms of the 24-hour flu and influenza, the flu, are different. The flu is a respiratory illness. Respiratory system symptoms of the flu include coughing, headaches, fever, runny nose, body aches. Some people with influenza may experience nausea and vomiting while they're sick. But these symptoms aren't as common in adults. Is the flu contagious? If you have the flu, you're contagious. Many people are contagious and can spread the virus as early as a day before they show symptoms. In other words, you may be sharing the virus before you even realize that you're sick. You may still be contagious 5 to 7 days after your symptoms appear. Young children are often contagious for more than 7 days after symptoms first appear. People who have a weak immune system may experience the virus symptoms longer, too. If you have the flu, stay home. Do your part to prevent the spread of the virus to other people. If you're diagnosed, alert anyone you came into contact with on the day before your symptoms appeared.